Hi guys, welcome back to another video of Untitled Chapter. So today we will be discussing about radial nerve paralysis. So the radial nerve is actually a part of or the largest nerve of the brachial plexus. So the brachial plexus is the connection system or the merging of the nervous system to supply entire forelimb and the shoulder region. So whenever there is any injury to the radial nerve, that will lead to paralysis problems because the radial nerve is supplying many muscles, that is many deep and very muscular muscles, so that their non-function will lead to paralysis. So at the musculospiral groove of the humerus, it divides into two parts, that is superficial branch and the deep branch, and it almost innervates all the muscles down to the humerus. The muscles which is present in the downside of the humerus will be innervated by the radial nerve. So the main radial nerve muscles are the triceps brachii, the tensor fascia antebrachii, anconeus muscle, brachialis muscle, extensors of forearm, ulnaris, lateralis. So all these muscles will be highly innervated by the radial nerve. All muscles on the dorsolateral side of the forearm is innervated by the branches of radial nerve or the radial nerve itself. So injury in the arm, that can be physical injury or due to any fracture injury or due to bestiality or due to any problems, is quite common since there is a thin layer of muscle separate from the nerve from the humerus. So whenever any small injury happens, the radial nerve can get damaged. So the damage to radial nerve has three main consequences. So that is paralysis of elbow extensors, paralysis of carpal and digital extensors, and anesthesis of the skin territory, because all the skin region and the carpal and digital flexors and elbow extensors are mainly supplied by the radial nerve by its parts, superficial and deep branch. Whenever there is any problems associated with the radial nerve, that will eventually lead to problems with elbow extensors, carpal and digital extensors, and the skin system. So extensive damage to the radial nerve proximal to the origin of tricipital branches is serious, very serious, because it prevents fixation of the elbow, prohibiting the limb from bearing weight. So the foot will be dragged, the animal will be dragging the foot, and also referred to as the dropped elbow condition. So the elbow will be dropped. More common in case of horses, since the injury, bestiality, or during the races, fracture, etc., that can happen. So moving to the treatment protocol, sometimes it can be due to the callus or any tumors in the forelimb that will be leading to pressure on the nerve that will lead to paralysis, and the tumor or the callus can be surgically extirpated out. And we can go for nerve tonics, that is vitamin B1, phospholecithin tonics in the feed supplement or as injection we can give. Calcium administration for more proper nerve conduction and muscular action, for proper muscular action and nerve conduction. Exercise to prevent muscle atrophy. So whenever the animal has got some radial nerve injuries or due to the nerve problems, the animal will not be able to move those muscles. So whenever these muscles are staying alone, like without any activities, that will lead to atrophy. So we will be giving some exercise to prevent any muscular atrophy. So if due to any rheumatism is happening, sodium salicylate is indicated because it can be considered as a very good non-steroidal anti-inflammatory drug which will prevent arthritic pain and arthritic muscular pain, etc. Corticosteroids quickens the recovery. They reduce the inflammation at the alarming rate or at a bigger rate than the NSAIDs. Corticosteroids can be used in the pain manifestation. Nerve stimulants drugs such as many nerve stimulant drugs, Neurobiome, Neuroserve, Neurovect injections are there. You can go for these injections. So electrotherapy for nerve functioning and IR rays, you can go for IR rays therapy that will eventually lead to activation of the muscular system. So thank you. So this topic will be coming under even in the lameness or in the anatomical section you can go for. So this is actually based on the surgery essay questions. Short note on radial nerve paralysis. Thank you.